Welcome to the Health Equity and Population Health module. In this module, several key concepts are defined to understand health disparities as avoidable differences in incidence, prevalence, mortality, and burden of disease, and other adverse health conditions that exist among specific population groups. Conditions in the places where people live, learn, work, and play affect a wide range of health risks and outcomes. These conditions are known as the social determinants of health. It is important to know this because health disparities are essentially quality measures. The Affordable Care Act and the Connecticut State Innovation Model aligns disparity dimensions with new value-based payment models. There are a variety of ways to address health disparities, and for more information, see the Health Impact Assessment module. Today, we have two important learning outcomes: define health disparities and discuss their importance in the context of health care, and describe how the social determinants of health impact individual and population health. Let's begin with the World Health Organization definition. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health as a resource is a complex set of highly interactive variables that influence an individual's ability to moderate and/or improve how the social determinants of health impact his or her life. Therefore, health is a resource for everyday life and not the object of living. It is a positive concept emphasizing social and personal resources as well as physical capabilities. The term health disparities refer to population-specific differences in the presence of disease, access to healthcare services, quality of healthcare, and patient outcomes that exist across racial and ethnic groups, among other minority populations. A health disparity exists because of the social conditions in which a person lives, grows, learns, plays, and works, and not due to genetics or behavior. Health disparities are seen in all major disease complexes: cancers, diabetes, cardiovascular disease, HIV and AIDS, as well as other sexually transmitted diseases, infant mortality, and mental illness. Health care disparities are related to health systems and health policies and can be classified as accessibility, for example, transportation to long-distance healthcare facilities or having to go to multiple facilities; acceptability, how well a healthcare system responds appropriately to beliefs and traditions; affordability, or the cost of healthcare. For many people, it's interrupted or inconsistent because of insurance coverage. And finally, availability, the length of time to get an appointment, for example, or being on a long waiting list for a place to accept Medicaid or Medicare insurance reimbursement. Health equity is the absence of systematic disparities in health status between groups with different levels of underlying social disadvantage, particularly referring to wealth, power, or prestige. Inequities in health systematically put groups of people who are already socially disadvantaged at further disadvantage with respect to their health. Health is essential to well-being in overcoming other effects of social disadvantage. Equity is an ethical principle. It is consonant with and closely related to human rights. Healthcare as a right can be summed as: people have the right to find and receive or access to care, and have the right to maintain appropriate quality care, as in continuity. In other words, all patients should have equal access to high-quality health care. The truth remains that some patients need more. Most often, low-income and patients of color, for example, require more of those resources to catch up, succeed, and eventually close disparity gaps. This is health equity. And this brings us to the social determinants of health and health status. So when we are talking about disparate groups of people, we are using the term interchangeably with minority populations. Minority status does not necessarily, however, correlate to population size, the number of people within a group. In addition to racial, as in Black or African American, and Latino, as in Hispanic minorities, other minority groups are based on age, such as children or the elderly, sex, sexual orientation and gender identity when they're not heterosexual, and national origin, including non-English speaking. Many minority groups are at a disadvantage of being at risk for uninsurance, lack of access to care, and experience worse health outcomes. Hispanics, Blacks, American Indians, Alaska Natives, and low-income whites are more likely to be uninsured relative to whites and those with higher incomes. Having multiple identifications, such as an African American gay man or a poor elderly person, is faced by more challenges and may need more health resources for equitable health outcomes compared to a married middle-class white woman. So disparities in health and healthcare not only affect the groups facing disparities, but also limits overall improvement in the quality of care and health for the broader population and results in unnecessary costs. As the population becomes more diverse, with peoples of color projected to account for over half of the population by 2045, it is increasingly important to address health disparities. The Patient Protection and Affordable Care Act contains numerous provisions with the power to reduce inequities in both health and health care. These include improved demographic data collection, broader clinical and community-based prevention efforts, funding for community health grants, expanded healthcare access for medically underserved populations, and stronger commitment to workforce training of public health and clinical healthcare providers. The legislation has also set in motion changes in Medicare and Medicaid reimbursement and performance incentive plans for hospitals and physicians that could further help reduce healthcare inequities. And of course, Connecticut CIM is piloting value-based payment in which you are participating right now. So as we mentioned, what are the causes of health disparities or health status? This diagram illustrates the social determinants of health, which are the conditions in which people live, including the health system. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels, which are themselves influenced by policy choices. The social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health status between groups of people and between countries for that matter. Addressing the social determinants of health, that is the underlying causes of health disparities, is the primary approach to achieve health equity. Examples of the social determinants of health impacting health and health outcomes are as follows. Cardiovascular disease is linked to social distress and racism and poverty. Type 2 diabetes is linked with food insecurity and limited access to fresh foods. Cancers are linked with certain job environmental conditions and are more likely to impact people of color and the poor. Social policies and practices that regulate the distribution of goods and services, and inadvertently they may discriminate. Social support networks, or those who are supportive of families and friends and communities, is linked to health, with stronger support leading to better health. In customs, cultures, and traditions, and the belief of the family and community can affect a person's health. Inheritance plays a part in determining lifespan and healthiness and the likelihood of developing certain illnesses. Men and women suffer from different diseases at different ages. Personal behavior and coping skills with life stressors affect health. Manageable stress and adaptive coping skills protect health, while multiple and chronic stressors can lead to maladaptive coping and poor behavior. Healthcare access and use of services to prevent and treat disease is what we're looking for. The determinants of population health. So this diagram illustrates the significance of the social determinants of health defined as social characteristics and represent half of the conditions influencing an individual health status. As previously stated, the social determinants refer to the social structures and public policies that influence the health status of a group who share common characteristics. This is known as population health, or otherwise known as patient populations. Note that population health is not just about the overall health of a population, but also includes the distribution of wealth. For example, some foreign-born immigrants have a better health status than their descendants born in the United States. In this case, the length of time in the United States may impact health status and may impact it negatively. Therefore, overall health may be quite high if the majority of a population is relatively healthy, even though a minority of the population is much less healthy. Ideally, such differences would be eliminated or at least substantially reduced. Population health is defined as the health outcomes of a group of individuals, including the distribution of outcomes within the group. These groups are often geographic in nature, such as nations or communities, but can also be other groups, such as employees, ethnic groups, disabled persons, prisoners, or any other defined group. For example, prisoners in the southern states have fewer educational opportunities than prisoners in the north. To look at subpopulations for target interventions, Puerto Rican adults have higher rates of chronic illness compared to other Latinos in the United States. Cuban Americans, Central and South American adults have lower chronic conditions than non-Latino adults in asthma, hypertension, and coronary heart disease. Leading health indicators for sexual and gender minorities include obesity, tobacco use, substance abuse, sexual behavior, mental health, violence and injury, and access to care. So what can healthcare organizations do? First, healthcare professionals should identify the subpopulations experiencing the disparities through their population health analytics. Then partner with your target or subpopulations by promoting health, preventing disease, and addressing health inequities to improve health outcomes, your quality and performance measures. Population health is concerned with both measurement of health outcomes and the pattern of population determinants and social determinants of health. Again, population determinants include medical care, public health interventions, genetics, and individual behavior, along with components of the social determinants, including income, education, employment, or culture, and the physical environment. Public health, on the other hand, can be defined as what we as a society do to collectively assure the conditions in which people can be healthy. Federal and state public health policies and programs play an important role in the health of the overall population of its nations and its states. Programs and policies to target interventions can be implemented at many different levels, from an individual health clinic or system, worksite to municipalities, regions, states, and even at the national level. Examples of effective health policies include smoking bans, excise tax on cigarettes and alcohol, seatbelt laws, water fluoridization, and menu labeling. There is an increasing call for health in all policies approach among population health leaders. Emerging in response to a growing understanding and recognition of the many different factors that influence health, health in all policy underscores the need for policymakers in various sectors such as education, housing, transportation, agriculture, economic development, environment, and others to carefully examine the health implication of the policies they put into place. Programs aimed at population health improvements are extremely diverse and address a full range of health determinants. They not only encompass efforts to improve access to health care and individual behavior, but also work to create healthy options and opportunities in the environments where people live, learn, work, and play. Population health program, as an example, the community-based organization program works to ensure all children have complete immunization records, as in the Kids Immunization Registry, which targets those who are not up to date with age-appropriate immunizations for education and outreach services. Outreach workers deliver key immunization education messages to families and provide assistance in helping parents get their children to the doctor's office. At the end of this presentation, can you define and describe health disparities and discuss its importance in the context of health care? And can you define and describe the social determinants of individual and population health and how they impact health inequalities now that you've listened to this training module? In closing, what is the difference between the concepts of health disparity and health equity, and why do we need to know? And how is health a resource in the context of health equity, and how the class standards can help? Something for you to reflect upon. Thank you.